First off, thank you three for having me, the partners of Gulf Coast Plastic Surgeries. It's amazing. This is my home, so it's pretty cool to be back here and speak in front of this many people. It's slightly terrifying. And then thank the sponsors too for just having us and allowing us all to be here. So originally I decided that I was gonna, present a lecture and try to just get a lot of good educational topics and maybe some tips for everybody to take home and hopefully live a little bit healthier of a life. Until I realized that I know about 25% of the people in this room, they've known me since before I was in puberty. So now my goal is just to convince those people that I'm not the idiot that I was when I was 17 years old. Where are my friends, by the way? Okay, I gave them the wrong time so that they didn't have to sit right up front, but I didn't really have to stare them in their eyes. Thank you, guys. All right, so a little bit about me. Dr. Levesque kind of covered a lot of it, but I was born and raised here. I went to Gulf Coast High School. Go Dolphins, shout out. I was raised around Andrews Institute, so my entire life I kind of saw the field of medicine in the world in the scope of human performance and optimization. So I'd be walking home to friends' houses in middle school and I would peek through the glass and see Shaquille O'Neal or Tim Tebow and all these amazing people that were in our small town. And I kind of just took that with me throughout my upbringing in high school and college, and then when I went into med school, I actually wanted to be a plastic surgeon. I grew up shadowing Dr. Levesque until I quickly realized that I'm not that badass and I can't sit in the middle. So I found something else to do. I'm completing my residency in PM&R, which nobody knows what that is. But basically we take care of people who have had some sort of traumatic incident, an injury, whether it be through sports, traumatic brain injury, stroke, spinal cord injury, and we try to piece them back together again and get them to be as able as possible. And when I was going through medical school, I realized a lot of the bad things about the field of medicine and sick care system and all of these things. COVID hit right in the middle of my first year, and it kind of lifted the veil a little bit on what we could be doing better at. And so I wanted to take kind of that field of longevity, I really wanted to dive into that and take my training in PM&R and kind of repurpose it and apply that to before function is actually lost so that we can avoid ending up in the hospital, or if we do end up in the hospital, we can have way better odds of getting through it and rehabbing. So I'm pursuing multiple different fellowships online. One of them is a well-known company called A4M, American Academy of Anti-Aging Medicine. I'm doing a longevity fellowship with them. I've gotten another fellowship called the American College of Lifestyle Medicine to partner with our residency program, so we're all kind of getting that education. I'm doing a couple of certifications in things like menopause, peptides, all of these new kind of modalities that are arising and that everybody's really excited about. So we're going to talk a little bit about those things today. So this is like one of my favorite quotes ever by Deion Sanders. If you look good, you feel good. If you feel good, you play good. If you play good, they pay good. So I was trying to think of how longevity really circled into the field of plastic surgery. And I think this kind of encompasses that. If you look better, you feel better. If you feel better, you start acting better. And I think you can literally take all three of those and put them in different orders and they all still go together. So the field of longevity is just a different order of those three things in the field of plastic surgery. If you start looking better, you are going to start acting younger, you're going to start feeling younger, vice versa. So I talked about this a little bit. We as doctors were trained to treat disease, not prevent disease. We are terrible at preventing disease. We're the best in the country at treating sick people. And at the same time, we're the best in the world at treating sick people, but at the same time, we're the worst in the world by far of keeping people from getting sick. So it's kind of a weird system that we're in. So we do have a sick care system. Right before I got into medical school, in the span of 4 years, I was diagnosed with strep throat 21 times. I was treated with antibiotics. It was every other month for 4 years. I was treated with antibiotics, given steroid shots, and sent on my way by the same place. I wasn't going anywhere different, and nobody really asked the question why. I was convinced to have sinus surgery because I really couldn't hear my professors. I was so stopped up all the time. I would call my parents in tears trying to get into medical school and pass all these hard classes. And I'd have to sit right up front, which I don't typically like to do, just because I had to hear what they were saying. I was convinced to get my tonsils out, saying that I would never get strep throat again, and 6 weeks later I got the worst strep throat of my entire life after they told me that wasn't possible. And So it's funny, this all happened literally leading up to me getting into medical school. So I went in with this weird sense that we're not teaching our doctors the right thing in order to keep people out of the hospital. The current model is basically putting Band-Aids on bullet holes. The way that I like to describe it is if you have a leak in your ceiling and you keep putting tape over the leak, the water's just gonna pop up somewhere else. So this functional medicine, longevity, preventative medicine area, whatever you wanna call it, is basically going up to the roof and figuring out where that leak's coming from and trying to stop it at the source. So what we like to do is try to get proactive labs with optimal ranges. I can't tell you how many times somebody has sent me their labs from their primary care visits, and I can basically only tell them that they do not currently have diabetes. So we want to really go more in depth into lab analysis, lifestyle first approach, root cause medicine is what we like to call it, and then obviously prevention so that we don't end up in these terrible situations that I see people in every single day in the hospital. So what fixes most problems? So 20% of the things fix 80% of the problems. So the way that I like to describe it, I see so many people that are getting down this rabbit hole of all the biohacking things before they're really taking care of the basics. If you were gonna try to build your dream kitchen on the 3rd floor of your house, you don't want to do that when the bottom floor of your house is basically put together with toothpicks, right? There's no point in doing that. You want to get the foundation first so that all of these things can work later. And I see so many people getting into all of these things like hyperbaric oxygen therapy or peptides or IV therapies, and it doesn't really work for them. And the reason is because they have at least one of these things that aren't really working in their favor. And if one of these things is off, then we're not going to be able to optimize correctly. So physical health is obviously huge. Nutrition and supplementation, sleep, and then stress management are the ones that we're going to touch on. So for physical health, muscle, cardio, and then protein are the non-negotiables for me. I think these are the ones that people kind of don't value enough, at least in the past. Muscle being the biggest one. Muscle is the greatest metabolic organ that we have. It is amazing for getting glucose out of the bloodstream, and I'm convinced that 90% of chronic disease and acute disease stemming from chronic disease somehow stems from insulin resistance, which usually is a buildup of blood sugar in the bloodstream for so long that you're releasing all this insulin to try to suck it back into the cells, and your pancreas gets tired and your cells get tired, and then you just lose the ability to do so. And excess glucose floating around the blood causes a ton of inflammation, which can lead to so many things like Alzheimer's disease, dementia, heart attack, stroke, all of these that we just hear about. And muscle is the greatest glucose disposal in the entire body, independent of insulin. So in a way, if you think of the greatest organ to allow you to have cheat meals, it's probably muscle. The more muscle you have, you're allowed to slip up on your diet every now and then, and it's probably going to be okay because your muscles are able to suck in that glucose pretty well. So 41% increased risk of dying from all causes if you're in the lower quartile of strength versus the higher quartile. So you obviously want to try to get as much muscle strength as possible, and obviously as early in life as possible, because you do lose muscle as you age. 1 in 3 adults over 65 who fracture a hip die within 1 year, and 50 to 70% of people who fracture a hip over 65 die in 5 years. The more muscle that you have, not only the more padding you have around your bones, but also the thicker your bones are from weight bearing, and the better you are also just proprioception in space. You're able to balance easier. You probably avoid having that fall in the first place. So this is probably the #1 way that I can see preventing one of the easiest things that really kill people when they get older. 2 to 4 times a week of simple strength training is enough. If you never step foot in the gym, I think it's worth paying a personal trainer just for 1 or 2 times and just say, hey, I've never been in a gym before. Can you just walk me around and just, make me be comfortable? Show me what to do so that I can do it myself. You don't have to pay somebody $1,000 a month for the rest of your life. You just have to know what to do and know the basics. This is a pretty wild thought too. Grip strength predicts cardiovascular events better than blood pressure does. And that's not saying that you should just go out and buy grip strength training tools. That's not really going to help you, but it is a proxy for strength in general. So the people that have higher grip strength are typically stronger and have more muscle mass, and the people who are stronger and have more muscle mass don't die from cardiovascular disease nearly as much as the people who don't have that. So VO2 max is basically our best measurement of cardiovascular fitness. You can do this at a simple place where you wear a mask and you get on a treadmill or a bike and you can measure your VO2 max. The reason why this is important is because your VO2 max is basically your body's ability to take oxygen and utilize it efficiently. And that goes down as you age. And I think a lot of people go through life expecting that they're gonna retire and then be able to do the things that they've always been able to do, like play golf, lift up your grandkids, lift your luggage overhead if you're traveling. And a lot of these things really require some level of VO2 max that is hard to attain if you haven't been working at it during those years leading up to the retirement age. So I see it all the time where people, get into their late 60s, early 70s, and they're shocked that they can't do the things that they've been dreaming about doing for the last 30 years. So this is really big, and it's easy to train. Zone 2 cardio is probably the biggest one. Walking is amazing for you, but it doesn't train this aspect of cardiovascular fitness. Zone 2, the easiest way to say it is 30 to 45 minutes, 2 to 3 times a week. Try to start walking with a weighted vest, get on a stair climber, do anything that you can get your heart rate up to the point where you feel a little bit uncomfortable holding a conversation, but you can still do it. So it's being out of breath, but being able to hold a conversation. And that tends to really work your VO2 max really well. So your labs aren't telling the truth. I kind of hinted about this earlier, where I would have friends send me it, and I can only diagnose a disease that's currently there. What you should be asking for from your doctor are things like fasting insulin. I think this is probably the #1 most important lab on the planet, because it shows up before your typical diabetes markers like hemoglobin A1C, potentially years before that. So if your fasting insulin is elevated, typically you want it around 5, but if it's elevated around above 10 or 15, it's giving you a good indication that you might be on the way to having some sort of metabolic resistance, leading to diabetes, and all these other things that we really don't want in life. If you want a really fun test for your doctor, ask them what has a worse outcome, HIV or type 2 diabetes, because the answer is not HIV, which is wild. Getting type 2 diabetes, it is treatable and it can be managed very well, but getting to the point where you have type 2 diabetes can be really negatively impactful for your health. And so that's why we want to get ahead of all these things. A full thyroid panel, not just your TSH. I want everybody to go and ask their doctors for this, because a lot of people are walking around with hypothyroidism, and it's a really easy thing to treat if your doctor knows what they're doing, and it could possibly make you feel dramatically better. As far as cholesterol labs, ApoB and Lp(a) are our 2 best cholesterol labs that we have. They're better than LDL in determining cardiovascular risk. ApoB is basically those particles that LDL attaches to, and it measures how many of those particles are floating through your blood and possibly attaching to the inner part of your arteries. Lp(a) you only need to take 1 time in your entire life. It's a genetic risk factor, and if it's elevated, it basically tells you you need to pay more attention to those labs than the average person and really get a hold on it. Vitamin D and omega-3, we'll talk about this, and then hormones we'll touch on later as well. So you can't out-supplement a bad diet, but if you have a great diet, the right supplements can really make some magic happen. We don't have the nutrition and the nutrients in our soil and our food that we used to even 50 years ago. And so a lot of people say, I can get everything I need out of diet. That might be true for some people, especially if you really have it down. But even if you're doing everything right, I think it's worth at least getting those labs tested to figure out if you have a deficiency in any area. So nutrition. I think a lot of people dramatically underestimate the amount of protein that they're getting every day. Usually people put this in grams per kilogram. Nobody knows how many kilograms they weigh. So 0.7 to 1 gram per pound of ideal body weight is the amount of protein that you want to get. So if you weigh 180 pounds, you want to try to aim for anywhere between 150 to 180 grams of protein every day, which is a lot, especially when you start noticing it. The key is just I think a lot of us dramatically overeat carbohydrates and we dramatically undereat protein. So when you start supplementing protein for carbohydrates, and you really get a better body composition, you start to feel better, you don't have those crashes, and it's just better all around. So 30 to 50 grams per meal really trigger muscle protein synthesis. Most people really do get half of what they need. Surround the plate with color, so the more colorful plate, the more phytonutrients you have. Berries are my favorite. Blueberries are probably the highest in polyphenols, and they're also low in glycemic index. So something like a banana has pretty high sugar and not a ton of phytonutrients. So you want to go with things like berries that really give you the best bang for your buck. And then obviously fresh, leafy greens, and really center that plate around the protein. And then cut the processed food. The biggest mistake that I see people make is drinking their calories, especially drinks that are heavy in sugar. It's really hard to drink more than 1 or 2 Coca-Colas a day and live a healthy life. So supplements that matter, we'll talk about supplements for a little bit. The first is that you want to test and you want to know what you're deficient in. And then the second one is you want to optimize, not just become not deficient in something, right? So there are optimal values. The traditional system doesn't teach us that well. We'll get into it. Creatine is by far my favorite supplement on the planet. You guys have probably been getting slammed with Instagram videos over the past year or two about creatine. It really is the best, most trendy supplement on the planet right now. And there's good reason for that. We've had over 30 years of research for it. It used to be a supplement that, at least when I was a kid and I came home with creatine, my parents thought that I was dealing it in the back alley of a Taco Bell. It was considered the weightlifter's supplement. And now we know that it has so many profound benefits beyond just muscle. It regenerates ATP, which is our body's energy system, and it does that so much more efficiently than we're able to do without creatine in our system. And now we're starting to find all of these brain and cognitive benefits that are really exciting, as well as sleep and mood. There are multiple studies showing a higher risk of depression with the lowest creatine intake. My favorite study came out a couple of years ago, and it was taking two groups, and they did cognitive testing on both groups. They gave one group 20 grams of creatine, which is 4 times the typical dose. They sleep deprived both groups for 24 hours, and then they had them retest that cognitive testing. The creatine group dramatically outperformed the non-creatine group after sleep deprivation. But the coolest part is that the group that got creatine after their first cognitive assessment before sleep deprivation improved their scores based on before they were sleep deprived. So they did better on 20 grams of creatine and 24 hours of no sleep than they did fully rested without creatine. So it really goes to show, I mean, I take 5 to 10 grams of creatine a day when I'm traveling or I'm sleep deprived or I know I'm not gonna have a good night to sleep. I will up that to 20 grams. It has been shown to be very safe for most people. I will say, do not constitute any of this as medical advice. Please, don't sue me. But everybody is different. All of these have been shown to be very safe, but everybody is different. Everyone has different past medical histories, surgical histories, things going on. So do work with some sort of practitioner in order to start these supplement protocols if you're going to. But all of these have been shown to be very safe in the vast majority of people. Vitamin D is another big one. So many people are deficient in it, or at least insufficient. When your labs come back and it shows your vitamin D is 32, the traditional lab will say that's normal. I would really encouraged to try to get to the 50 to 80 mark. We know that vitamin D is involved in over 1,000 gene regulations in the entire body. It's really a hormone instead of a vitamin. I think it's been downplayed in that way over the years. 17 to 31% reduced risk of all-cause mortality with optimal levels based on whatever study you're looking at. And the vast majority of Americans are insufficient in vitamin D. We're not getting outside as much as we used to. Even half of surfers are deficient in vitamin D. So it's pretty hard to make that case that you go outside for 20 minutes on a walk and you're gonna be good. So I like to aim for 50 to 80. Dosing protocol for most people, 4,000 to 5,000 units of vitamin D every day, paired with K2 is the best way to go. K2 is always included because the theory is that vitamin D regulates your calcium that's inside your body, and if you have K2 paired with it, it will shuttle that calcium into bone rather than hanging out in your arteries where you don't want it to hang out. So, magnesium. If you haven't heard of magnesium at this point, you are living under a rock. Magnesium is involved in so many, 300 enzymatic processes in the body: blood pressure, mood, sleep, muscle soreness, rehabilitate. There's so many different things. Just overall vitality. It's really hard to overdo magnesium. About half of us, if not more, I would argue more, are deficient in magnesium, and it's involved in so many things like cardiovascular risk, dementia, tons of things. There are multiple different forms of magnesium. If you go to your typical CVS or Walmart, you're probably going to find magnesium oxide. It is the cheapest one. It's the one they use in the hospitals. And it's about 2%, maybe 4% on a good day, bioavailable, so you're really not absorbing any of it. It's sad that I even see it in stores. I don't know why. So if you see something with just big old magnesium letters on the front, I would look at the back and make sure what type it is. Glycinate's probably the best one. I tell people, 150 to 400 milligrams a night typically helps, sleep regulation. It's amazing. If that doesn't help, there is magnesium threonate, which crosses the blood-brain barrier. And so people sometimes have a lot better of a reaction to that in terms of trying to get to sleep. It is a little bit more expensive, so I always say start with glycinate, see where it goes. If you do have like a lot of muscle soreness or it's hard to recover from workouts, magnesium malate is also amazing, and you can mix and match these things however you want. You can take magnesium malate in the morning, magnesium glycinate in the evening. Sometimes it does have a little bit of effect on people's gut. Usually that's magnesium citrate that has that gut effect. So if you're doing these in small doses and you kind of titrate up to your best dose, usually you're good off. All right, omega-3s. This is a wild one. So there was a study that came out a couple of years ago that basically compared omega-3 deficiency to smoking, and they found that if you have an omega-3 index, which is an easy test to do if you ask your doctor for it, below 4%, you have the same overall mortality risk as if you were a smoker, which is kind of wild. Most Americans are sitting around that 4% mark, usually between 4 and 5, and we really want to get above 8. Most people in Japan are sitting above 8, and they have a significantly longer lifespan than we do. So omega-3s are amazing. They are involved in anti-inflammatory processes. Usually we want to go with the animal version of omega-3s. It's the most bioavailable. A lot of people try to take the plant version, and it really only converts into the usable form by about 10%. So I'd like to stick with EPA and DHA. Those are the animal derived omega-3s. It's involved in brain health. So DHA itself makes up 40% of the polyunsaturated fatty acids in the brain. Your brain is mostly fat. Most of that fat is DHA. So therefore, if you maintain adequate levels of DHA, you are at least promising yourself somewhat of safety of cognitive decline. It's kind of a safety net. So I really like to take anywhere between 2 and 4 grams of EPA to DHA daily. Usually 2 grams. It can get expensive, so I think 2 grams is kind of your best bet. 1 gram does well too, but I think for most people, they really do need this. This is one of the things that not many of us are eating fish on a day-to-day basis, so it's one of those things that we have to get in. So these are just fun other supplements. These are not ones that you need to take every day. L-theanine is amazing. I took it right before coming here. It's awesome for generalized anxiety. It's good for sleep. It's good for mood. It's good for this kind of calm focus. And if you're somebody who drinks coffee and you get the coffee jitters, it's a good little health hack that you can take L-theanine with your coffee and you don't have the coffee jitters. So kind of a cool little supplement. Sulforaphane is a new one that's been coming up in recent years. It's derived from broccoli sprout. And it's one of the only supplements that I have seen that really is able to expel microplastics to a significant extent. So there was a study doing sulforaphane in 2 groups of people, and the amount of urinary microplastics that they were expelling in the sulforaphane group was dramatically higher than the amount who was not taking it. Microplastics are obviously everywhere. We don't have a ton of data on it. I'm assuming it's not doing any good. So definitely something to look forward to. N-acetylcysteine is a precursor to glutathione, which is the body's master antioxidant system. You think about going and having a full bender, your glutathione stores are probably hurting that next morning. So N-acetylcysteine is a good one to replenish glutathione. It's great for liver detoxification, not just with drinking, but just with everything in general. CoQ10 is another amazing one. It helps with ATP production in the mitochondrial transport chain, which is where we make about 80% of our body's energy. A lot of times it gets stopped. Our energy production, especially as we age, gets stopped at that certain step where CoQ10 can really help out. Especially if you're somebody who's taking a statin. One of the most common statin side effects is muscle pain and fatigue. Statins tend to decrease the amount of CoQ10 in your body, and ironically, CoQ10 deficiency can cause muscle pain and fatigue. So usually when we see people supplement with CoQ10 who are on statins, that goes away. And then whey protein, obviously, quite a few people in this room gasped earlier when I said how much protein you should be consuming. Whey protein, if you're able to tolerate it, some people's stomach can't handle it, but it's a really good, easy, low-calorie way to get in your protein needs. And if you source it correctly from a grass-fed source, I really see no problem in it. I take whey protein pretty much every single day. If it does bother your stomach, there are 3 different iterations. You can go whey protein, you can go whey protein isolate, which is a little bit less lactose and easier on the stomach, and then hydrolyzed whey protein, which is more expensive, but there's almost no lactose in it, and so some people might respond better to it. So sleep, I'm not here to lecture you about sleep. Sleep is kind of like your mom telling you to put ice on an injury. Everybody knows that it's important, but nobody really does it well, and we all dramatically underestimate the power of it. These are just kind of the things that I see a lot of people miss when it comes to sleep. Probably the biggest one is cutting out all ambient light in your bedroom. Blackout blinds can be massive for this. There's multiple studies showing that even the little lights that are on like the Wi-Fi router on the ceiling that are beeping, or like in a hotel room, can dramatically hurt your sleep. And so it's best to get literally any light possible out of the bedroom. If you get up to go to the bathroom at night and you're scared that you're gonna trip over yourself, get a flashlight next to your bed. I don't know what to say. Try to get a colder room. So anywhere between 66 degrees and 69 degrees is what's been shown in the studies to have the deepest sleep. Some people in here, I can tell, are probably sleeping with it at 75, which that's fine, but I would encourage you to just try to go down a couple of degrees and see how your sleep improves from there. Don't Venmo request me for your utilities bill. Another one is take a warm shower before bed. So this is kind of the same workaround as getting your bedroom as cold as possible. Warm shower before bed brings your blood vessels to the surface of your skin. It tries to cool you off, so by the time you get out of that warm shower, your blood vessels are interacting more so with the ambient room temperature. It brings your core body temperature down, and it really puts you into a good deep sleep state. So warm shower before bed is amazing. Morning sunlight is probably the most underrated one. Andrew Huberman has brought this to light in the last couple of years. Probably the best sleep hack that I know of. All of us are so busy on a day-to-day basis. We're not living in a very normal atmosphere. We're not getting outside as much as we should. We're not getting that natural sunlight like we did 100, 200 years ago, like our ancestors did. They were constantly outside. Our body, our brain is wired to recognize morning sunlight and spike our cortisol in the morning, and it basically starts kind of a time bomb for melatonin to release 16 hours later. So if you're not getting morning sunlight, fluorescent lighting really doesn't do it. It's not as bright as we think it is. And so the best thing I could possibly say is to try to get outside within 15 to 30 minutes of waking. It'll spike your cortisol so that it's able to come down later in the day. That's your stress hormone. You'll find that you're less stressed at night, you're better able to go to sleep, and your natural melatonin production will start to come back. Sleep support, so we'll talk about a couple of these I'll just go through. Glycine lowers core body temperature, similar to how a warm shower does. It's an amazing supplement. Magnesium glycinate, we spoke about that, and L-theanine. L-theanine sometimes gives people some wild dreams. So if you are somebody who has nightmares, I would probably avoid it. If you're somebody who loves wild dreams, strap in. Progesterone is huge for women, so I know probably quite a few women here are on hormone replacement therapy and can speak to the power of starting oral progesterone therapy. So if you are in that menopause range, and you are having sleep problems, I encourage you to find a doctor who knows how to treat with hormone replacement therapy and maybe talk about progesterone, because it can really change your sleep habits. So stress, we all know that your body is only as powerful as your brain perceives it to be. I started doing mindfulness meditation and breath work when I was in medical school. This is right after my 21 bouts of strep throat. I don't know what really changed it, but I didn't get sick nearly as often. And when I started doing mindfulness meditation, I was just overall more comfortable in my skin. I was able to look at people in the eyes. I was able to remember people's names better. It was just better for my overall vitality and my well-being. So could not recommend that more. It helps regulate cortisol. We're all at kind of a heightened state 24/7 with social media, fluorescent lighting, all these things that are stressing us out. Walking without a phone is probably, if you were gonna do one thing when you leave here, I would say spend the next 30 days walking for 45 minutes right after you wake up. Not only are you getting the benefits of walking, you're also getting that mindfulness if you're going without a phone. Don't do this if you live in a sketchy area. And you're also getting that morning sunlight in your eyes, so you're really killing multiple birds with one stone. All right, peptides. Who has heard about peptides before? Yeah, quite a few people. Recent news, so the FDA yesterday took 12 of the previously banned peptides and put them back on the compounding pharmacy list, which is amazing. I think what happened in 2023 when they took a lot of those peptides off is that they forced a lot of consumers over to the black market that were getting research peptides. There are some safer research peptide places than others, but in general, there are no incentives for a research peptide brand to really keep you safe. They're not gonna pay $500, $3,000 for the filters that compounding pharmacies are supposed to use to keep endotoxin and all these horrible things out of your peptides. And usually with these research peptide places, the amount that's actually in the bottle varies by about 20% either way. So you're either underdosing or getting way more than you really want to. So I think this is good news that we're putting this back into a clinical conversation instead of a back alley. So So what are peptides? Peptides are short chains of amino acids. They are shorter than a protein. A protein is typically thousands of amino acids. A peptide can range anywhere between 3 amino acids to 150, 300 amino acids. What it does is it acts as a signaling molecule to tell your body to start performing a function that it already does, just to a better extent. So the way I like to describe it is, if you think about typical medication is like adding a stranger to your group chat. It can really add something that's beneficial, but it also can throw off the entire group chat, function. So it's forcing a outcome from the outside. What a peptide does is it's basically giving your friend a pep talk to perform a function that they're already able to do, just at a better extent. Now, that doesn't mean they're 100% safe, because we know that we can convince our friends to do some pretty stupid stuff. So, they typically do have minimal side effects though. I will put an asterisk by that. Some peptides are worse than others, but for the most part, compared to a lot of medications, they're generally well tolerated, and they work with your body's existing pathways. Most of them are subcutaneous injections, so like an insulin needle in the belly area. A lot of them have started to be nasal sprays. Some of them are oral now, which is amazing that we're starting to get those different ones. And a lot of people can have benefits within a matter of weeks. I will say a lot of these peptides that are very hyped don't have a lot of data in it. We'll start to see more, hopefully, as the years go on. I also will say that the placebo effect is a powerful drug too. If you gave somebody a sugar pill and told them it was a blood pressure medication, there's a good chance that their blood pressure will probably go down. So I wouldn't believe everything that you hear, but peptides are very exciting, and I'm pumped that this is becoming more of a mainstream thing to talk about with your doctor. So we'll just go through a couple. Growth hormone releasing peptides. These are restoring what time takes away. After about 30 years old, your natural growth hormone tends to decline as you age. This is really key in vitality. You're able to hold on to muscle. You're able to sleep better. All of these good things come from growth hormone. These are the 3 that are kind of the most popular: ipamorelin and CJC. This is what's known as the cleanest growth hormone related peptide. It targets the receptor really well. Sermorelin is also really popular. That one's able to be compounded right now, so it is in compounding pharmacies. So you're able to have that conversation with your doctor. It focuses as a growth hormone releasing peptide and an analog, so it targets 2 different receptors. You don't need CJC added with it. It has a longer bit of half-life. Most of these are targeting, lean mass, holding on to lean mass while trying to trim a little bit of body fat. Where I see these peptides really coming into play is people on GLP-1s. We'll talk about GLP-1s in a second, but we see people losing a lot of muscle mass with GLP-1s, sometimes even when they are strength training and keeping protein up. And so these can be important to kind of pair with GLP-1s to really hold on to that lean mass. Anti-inflammatory ones. So I'm sure a lot of people in here have heard of BPC 157, TB 500. That's what's known as the Wolverine stack. That has become really popular with injuries. People say that it is anti-inflammatory and it's able to heal soft tissue injuries a lot easier. We don't have a ton of data on it. The data that we do have says that for the most part it appears to be very safe, but we have a ton of anecdotal data. So basically people's stories of saying, I injected myself with BPC, my tennis elbow that's been there for 15 years has gone away. So I'll just leave that at that. PDA is just kind of BPC 157. After they took that out of the market, they created another one that was 1 amino acid away, and it actually ended up working out really well. GHK copper peptide, that's probably the one that the plastic surgeons are most excited about. It is involved with wound healing, tissue regeneration, DNA repair, collagen turnover. It's kind of known as the Barbie peptide. So this is one that a lot of people are probably going to start using either before or after surgeries to try to improve their outcomes. Okay, neuropeptides. So Samax and Salank are kind of thing 1 and thing 2. Samax, usually it's a nasal spray, increases brain-derived neurotropic factor, it heightens focus, clarity, verbal fluency, all of these things. It's kind of known as your cognitive gas pedal. So some people really like to take this when they have mentally stimulating tasks. Salank is kind of the opposite. It's the rest and digest peptide, so it helps you calm down a little bit. It's an anxiolytic, so it's not sedating, however, but it is good. Maybe after a long, stressful day, some people that can't wind down might think about this peptide. Cerebrolysin, I haven't seen this used in practice a ton, but it is really interesting. It's going to be seen more and more. It's pig-derived nootropics, basically, and it is under investigation for Alzheimer's and Parkinson's, and it's currently being used quite a bit in Europe and Asia. Couple more. So thymosin alpha 1. This is a really cool one for immune modulation. So it doesn't necessarily boost your immune system. It does both. It will either calm down your immune system or boost it depending on what a certain person needs. People that do possibly benefit from this are people with autoimmune conditions, with post-viral syndrome. So you think about long COVID. I know quite a few people who have suffered from long COVID, post-Lyme disease, chronic Epstein-Barr virus, recurrent infections, post-surgical immune recovery. There are a lot of different things that people can use thymosin alpha 1 for. Usually it's subcutaneous injection Monday to Friday. You cycle on and off, maybe a month or two on, 2 months off. So GLP-1s. There are a couple iterations of GLP-1s. I initially was not somebody who loved GLP-1s when they first came on the scene. They've actually been around for a long time, but semaglutide or Ozempic was the first one to really make a name for itself. I've since come around. I think they can be done correctly, and they really are probably the best tool that we have for weight loss. Semaglutide is a GLP-1 agonist. This is kind of the first step. We've since moved past that to tirzepatide, which has become a little bit more popular. It targets one more receptor. It tends to have a little bit better of outcomes, sometimes even less side effects. The new one that's in the pipeline right now is retatrutide. That one has not been completely approved yet, but has passed phase 3 trials and shows some pretty promising results. Up to 24% body weight loss at 48 weeks. That's a lot of body weight loss. Not all of that is fat, so we'll talk about that. Adding that glucagon receptor really helps kind of target fat loss rather than muscle loss though. So this will be one that we'll probably hear a lot more about within the next year. So here's the problem that initially made me really turned off about GLP-1s is that typically when you go on a weight loss journey, the amount of muscle that you lose compared to fat is usually about 15%. What we're seeing with GLP-1s is that increases to 30% or more. So we see a lot of people who are losing weight, but in a way, their body composition is actually getting fatter. And that can be a huge issue in terms of getting off of the drug because, like I said earlier, your muscle is the biggest metabolic organ that you have. If you have less of it and you get off of a GLP-1, you're going to respond a lot worse to common dietary changes or slipping up every now and then than you would before you actually got on the drug. So the way to combat this is obviously resistance training 2 to 4 times a week, like we talked about. Really get in the gym, make sure that you're doing compound lifts. A lot of people go to Pilates and yoga, which is amazing for so many other things. It's really hard to get progressive overload with things like Pilates. So after a couple of months, you're kind of stalled out. You might be able to tone and get good cardiovascular fitness, but you're not able to add weight. So I really like traditional strength training or high intensity training. High protein, 0.7 to 1 grams of protein per pound of body weight. And then like we talked about peptide support, so maybe with a growth hormone releasing peptide, if you talk to your doctor and you decide that that's maybe something that you could consider. And then DEXA scan, I know you guys have the in-body scan too, that's an amazing one. What I see a lot of people is they're chasing the scale, and what they should be chasing is body recomposition. So if you're really doing this correctly, you can actually stay the same weight for quite a while and lose a lot of fat and gain a little bit of muscle, since muscle weighs more than fat. So I see a lot of people who maybe even stop going to the gym or stop consuming that protein because they're looking at the scale and it's not moving. But if you're doing something like a DEXA scan or an in-body, then after a couple months you're redoing your scan and you're realizing that you're gaining a lot of muscle and you've already lost a lot of fat, and that will end up looking better and you will feel much better in the end. So upside, beyond weight loss, GLP-1s actually have been shown to be cardio-effective. The SELECT trial came out a few years ago. This is actually really interesting. Semaglutide reduced major cardiovascular events by 20% versus placebo, and they even went back and restudied this and kind of got rid of the bias of weight loss, because they said, okay, maybe it's because of weight loss that people are having less cardiovascular events. Well, they actually controlled for weight loss, and they still saw an independent cardioprotective effect. So we don't really know what's going on there, but it does seem to have a cardioprotective effect. Neuroprotective effect as well. There's multiple studies that are kind of emerging right now, so I'm interested to see where that goes. And then a metabolic reset. If you're doing this correctly, you're maintaining muscle mass, then you really can change your overall body composition in your life and hopefully get off of these drugs so you don't have to be on a drug the rest of your life. Hormone replacement therapy. This is probably the #1 most impactful thing that I think has been devalued in the last 20 to 30 years. A study came out in 2003 from the Women's Health Initiative that kind of talked really negatively about estrogen and progesterone therapy in women. It said that it caused cancer, it said that it caused blood clots. They actually released the findings of the study before the actual study came out, so it was all over the news, it's all over the New York Times. And then the study came out, and what people realized is that, okay, the study actually didn't say that. If you go back and look at the data, it wasn't significantly, statistically significant. It also was using synthetic progesterone and synthetic estrogen, and that is not typically what we use now. We use bioidentical. So it really put us in this massive 20-year stint of turmoil in the medical community, and probably the worst thing to come of that is not only keeping 20 million women from getting on a potential life-changing treatment, but it was also not teaching our doctors how to do simple hormone replacement therapy. You know, I went to medical school for 4 years. We learned a lot about bleomycin and all these other cancer drugs that 99% of us will never see in practice, but not one time and not 1 minute did we talk about how to simply, put somebody's estrogen back into them after they go through menopause, or testosterone, and all these things that can really reduce somebody's vitality. So hopefully we will get back to that, because previously, medical care taught every doctor how to do that, whether you were a plastic surgeon or an orthopedic surgeon or a urologist. Pretty much across the board, everybody knew how to do that, and now none of us coming out of med school do. So it has so many unbelievable benefits if you do it correctly. Typically for women, anytime within 10 years after starting menopause, or up to the age of 60 is kind of the ideal time to start hormone replacement therapy. Some women do well even after that time, and that's a conversation to have with your doctor, but most of the data comes from starting it within that time. Can significantly reduce cardiovascular events, lowers Alzheimer's risk. Bone mineral density is probably the biggest one. We talked about fall risk earlier and fracturing your hip. Getting on quality hormone replacement therapy with somebody that knows what they're doing in the right amount of time can dramatically reduce the amount of bone loss that you have throughout life. For testosterone replacement therapy in men, this one's interesting. So this one actually kind of got demonized in the Olympics in 1988. The doping scandal really put testosterone replacement therapy on the map as a steroid, and so they demonized it. They put it on the list of drugs to watch out for, pretty much up there with opioids. So that kind of played in with the educational point of it, of where doctors just didn't really want to touch testosterone anymore. Baseball made it worse with Sammy Sosa and all those guys that were really juicing, and then it kind of created the stigma of, okay, if you go on testosterone replacement therapy, you're gonna have roid rage, you're gonna be angry. Typically, we don't see that. Actually, testosterone replacement therapy, if done correctly, is really associated with positivity and patience in men who are hypogonadism. So basically, after you hit 40, 50 years old, you're not having as much testosterone running through your veins as you usually do. And reintroducing that in physiologic levels can have so many positive benefits, from energy to muscle mass to vitality to sexual function, all of these things that really, make us live our day-to-day life. So TRT is something that I think will become more popular than it even is now. The cases that you see of people getting angry or irritated on testosterone usually is because some men have an estrogen effect when they take testosterone, and it's because their estrogen is a little bit too high, and that's something that you can manage. So usually when we bring people back down to a normal estrogen level, all of that kind of balances out. All right, so we're almost done. A couple of recovery tools that actually do work. Red light therapy is amazing for mitochondrial health. Skin rejuvenation, wound healing, you guys know this more than anybody. One thing that I do see is a lot of people will buy like a $100 red light mask on Amazon. Probably not working, but maybe the placebo effect of you thinking it's working might. So you really have to get a high-powered one. A lot of people do go to these places like skincare clinics to really do that, because a lot of these ones are possibly thousands of dollars, tens of thousands of dollars to really get it done correctly. Hyperbaric oxygen therapy can be amazing for so many things. It does take quite a bit of time to do. So, it's a case-by-case basis. Usually you have to do somewhere between 10 and 40 sessions to have a huge effect, but it really can have a massive effect for people. You have to stay in there for a while. IV therapy, so this is a really fun one. IV therapies can dramatically change the way that people feel immediately. Things like glutathione, high-dose vitamin C, it can really have a huge impact on your vitality. NAD is probably the number one IV therapy that I've seen change people's lives. It's not one that you just go on a whim and get, like an IV bag or like a vitamin C bag. NAD is usually done 5 treatments in a span of 10 to 15 days, and then once a month. It's amazing for just renewing your mitochondria, your energy production, your overall electron transport chain, basically your ability to produce energy that goes down as you age. It's not comfortable. It actually kind of has a doomsday effect where you start getting IV NAD and your chest will start hurting, maybe your stomach starts hurting, your legs feel heavy. It's not dangerous, it just feels terrible. And so people that are not ready for it get a little freaked out about it. I haven't seen any negative effects of it, things actually happening during the therapy, but it's something to note that you need to be ready for having a little bit of an uncomfortable experience while doing it, but it could have a huge result. Sauna. I'm not going to read through all this. We all know that sauna is amazing. There was that Finnish study a while back that showed that doing sauna at least 3 times a week for anywhere between 18 to 25 minutes at anywhere between 175 degrees Fahrenheit to 210 degrees Fahrenheit has amazing benefits on all-cause mortality, whether that's cardiovascular disease, dementia, insulin resistance, diabetes, so many things. Red light saunas do work. You typically have to stay in there longer because they're not as hot, so maybe 30, 45 minutes in a red light sauna, and you can still have those heat shock protein benefits. So sauna is kind of one of those really low-hanging fruits that I see that people can literally just sit there and get benefits. If you're having fun the entire time, it's not hot enough though. Okay, so what's on the horizon? These are just a few things that I think we're going to start seeing more and more of. Stem cells are really promising. Florida just opened the gates in July on IV stem cells. I know multiple people who have gotten it done, had great benefits. I also know some that nothing happened and they wasted $10,000 to $15,000. So we don't exactly know how they work, but they are exciting, and I think we will learn more. I'm not going to speak about it more because I don't know what I'm talking about from here on out. Exosomes are really interesting too. They're similar to stem cells, but they're actually just the messengers that stem cells are able to release. So you're not even sending cells out, you're basically sending your body a bunch of messages on how to perform a certain task, like rejuvenating tissue or cartilage or whatever. CRISPR is probably what's going to be the biggest change in medicine over the next 10 years. It's a rat race right now to figure out how to do it efficiently, but it's basically gene editing to get ahead of things that you're predisposed to, like any sort of disease states. So I keep seeing stuff about that. Haven't seen it in practice yet, but we probably will. And then there's things like EBO2 and plasmapheresis, where you basically take your blood, you recycle it through a bag, you run it through a filter, and then you put your blood back in you. And I've seen this work a lot, especially in conjugation with things like thymosin alpha-1 for people who have any sort of autoimmune condition, long COVID, anything like that. So really interesting. So you don't need to overhaul your life. Just start with 3 things. Here are 3 things that you can go to and do today or tomorrow. Go on a morning walk, no phone, no sunglasses. Try to get out as early as possible when the sun's actually awake, and go for a walk for at least 20 minutes. The movement is amazing. The morning sunlight is amazing for your overall, cortisol production, for your circadian rhythm, for so many different things. And it's also a mindfulness activity, especially if you don't have your phone. You will feel naked without your phone for the first 20 minutes. You will get used to it. Strength training and hit your protein goals 2 to 4 times per week. Start strength training. Get a personal trainer for just a couple of times if you need to. Have them teach you what to do. Try to get enough protein. Just track how much protein you're eating on a daily basis for 6 days and just see what that looks like on a plate so that you can go forward and just kind of have an idea. I'm not a huge fan of tracking your macros and everything religiously. I think it can be more stressful than anything, but I think it's good to have a general idea of what it looks like on the plate. And then get comprehensive labs. So find a doctor, work with a doctor. There's so many of these telehealth ones too, and you can actually bring those telehealth things to your doctor, of getting a full comprehensive blood panel, your thyroid, your hormones, your vitamins, all of the cholesterol stuff, omega-3 index, ask about your hormones. If your doctor dismisses it, that's a general indication of that you should probably find another doctor. I can't tell you how many times that I've had conversations with people and I'm like, just go to your doctor and ask them to order these things, and the doctor completely writes it off. And it just tells me that physicians don't have a lot of time to research things, and they're seeing patients every 6 minutes for 8 hours a day. And so a lot of people just write these things off and think that they're kind of BS, but they're not, so it's a huge thing to do. And then just future medicine stuff. Preventative care and sick care, I think, go hand in hand. One doesn't replace the other. If you have a doctor that treats you when you're sick, you should have a doctor that tries to keep you from getting sick. I think we're gonna see this more and more. The targeted labs, we're gonna see genetic profiling, and then AI-powered medicine is really interesting, especially with intake forms. You're gonna start seeing your typical doctor intake forms ask you a lot of questions that are tailored to your last answer, which gives the doctor a lot more power before he even walks in the room on knowing what he's dealing with, or he or she is dealing with. So that's really interesting. All right, I'm sorry for forcing all of that down your throat.
No.
If anyone has questions. Are there questions?
Is there a particular supplement that you recommend?
So there's, creatine, vitamin D, omega-3s, and magnesium are my 4 go-to always. I think most people can benefit from those. I still recommend getting your labs tested though.
What about a brand?
A brand? So I'm not affiliated with any of these brands. Pure Encapsulations I think is great. Metagenics is another good one. I would not go to CVS and get a brand. I'd probably go to these brands' websites and find them. Subco.
Or you can come to the skincare center.
Right.